So I heard you talking about my jaw clicking. What exactly is TMJ? You said I have TMJ.
Yeah. Well, TMJ actually stands for temporomandibular joint. It's the name of the jaw joint. It's also kind of a catch-all phrase for a whole bunch of symptoms. Jaw pain, headaches, neck pain, muscle spasms, difficulty in opening the mouth, a whole bunch of different signs and symptoms that kind of get lumped into the phrase TMJ. In your case, we had talked about that you do some clenching and grinding, that you have some headaches and some muscle tightness. Essentially, the lower jaw is a very unique bone in the body. It's the only bone in the body that has a joint on either side of the body at the same time. It's also the only bone that actually just hangs there. It's not really directly connected to any other part of the body other than by ligaments and muscle and skin and soft tissue that really holds it in place. Right. And the clicking, what that signifies, the lower jaw, when we open, we don't just open like this. We actually start that way, and then the lower jaw comes down and forward, and so there's kind of we call it rotation and then a translation forward. There's a disc of cartilage there between the lower jaw and the upper jaw. It's pretty much like a ball and socket, like your knee and shoulder. And as you open and come forward, that disc of cartilage should come forward with the jaw. In your case, probably because a little bit of the narrowness of your jaw, the lower jaw is back a little bit more, and that's just the way you grew. But that disc of cartilage is now a little bit forward because the lower jaw is back. Okay. As you open, that disc of cartilage is kind of in the way, and sometimes it can inhibit people from opening. Sometimes it can make it such that you have to wiggle your jaw to get it open until that disc of cartilage pops or clicks back into place, and that's that clicking. The concern with that is that can get worse and worse. Ligaments actually hold that disc in place, and once it gets out of position, those ligaments get stretched, and then it can't reclaim that original position. Okay. But certainly by itself. And again, the concern is that disc gets further and further out of position and can actually block the jaw from opening, and then some people will present with the inability to open. They can open that rotation part but cannot translate, so they can't open really wide. Oh, okay. And then it can also lead to other issues where with that disc being forward, the jawbone now goes further back and higher up into an area that it shouldn't be, and the body doesn't like it because there's nerves and blood vessels back there, and that can contribute to inflammation and muscle spasm and cause actually the body to take postural changes that now can lead to neck pain. And so you can see how all of those signs and symptoms can all fall under that one envelope of the term TMJ. Okay. What can you do to treat it? Well, certainly it's a number of things that we can do. A lot of times the worst part is in the morning for a lot of people. Mm-hmm. And that's because studies have shown that the amount of force that we put on our jaws and teeth at night if we clench and grind is 8-10 times more than we ever do during the day. And also the duration of time that the teeth are in contact is again significantly greater than we ever do during the day, even when chewing. And sometimes the teeth bear the brunt of that and will grind down over time, and that's why we talked about a protective guard to wear at night to protect the teeth. Right. But sometimes the muscles in the jaw joint are actually what suffers, and we can look at, why are you clenching or grinding? Why are you really doing something at night that is causing you to wake up with these headaches, muscle pain, clicking, again worse in the morning, and there are definitely different things that we can do to address that. Sometimes it is necessary to actually do orthodontics or orthopedics to expand the jaws and move the teeth into a position, allow the jaw to go into a more forward position, so you have the potential of eliminating that click.
Okay, that makes sense.